topic for today is going to be health science. Sorry about that. Our topic for today is health science. But before I continue, I'd like to recognize the presence of our speakers once more for the day. First up, we have Dr. Agbaraolorunpo Francis, who works in the Physiology Department, University of Lagos. We have Dr. Victoria De Niro, Memorial Hospital, Philadelphia, USA. We have Mr. Taiwo James, a nurse of Lagos State University Teaching Hospital, LASUT. We also have Mrs. Mabel Okereafor, Developmental Child Psychologist, Clinical Director, Nurture a Child Development Limited. We want to welcome you all for coming. We appreciate your presence and your time. So for this session to go in an orderly way, so we won't be interrupting each other. If we have any questions or contribution that I would like to give and we want to cut each other off, you could just come to on our screen. You see the chat. Then you message us. So we'll read. So I'm going to read your questions out. Or if you want to say something, you can also go to the reaction and raise your hand up. So we'll have this thing. We'll have this session in a very orderly manner. We won't just be jumping on each other. Yeah. So I want to welcome you again and thank you for coming. So the first question we should ask ourselves is, what is health science? Health science is the application of science to health, including the study of medicine, nutrition, and other health-related topics. I'll come again. Health science is the application of science to health, including the study of medicine, nutrition, and other related topics. What I'm trying to say is that health science studies all aspects of health, including disease and healthcare. This field of study, this health science field, it aims to develop knowledge, interaction, and technology for the use of healthcare to improve the treatment of patients. So every treatment, every technology that we develop, the process of developing those treatments and technology for the purpose of improving the treatment of patients and for the general improvement of health, that is health science. So before I continue, I'd like to ask Dr. Agbaraolorunpo Francis. I'd like to ask him, please, sir, can you kindly tell us what your role is in the physiology department and how you got into the role, sir? Thank you. Hello? Okay. No, sir, we can't hear you. We can't.
We can see him talking. We can't hear.
Yeah, we can't hear you, sir. Can you hear us, sir?
I don't think he hears it.
Okay. So that will not delay ourselves, let's just move the question to Mrs. Mabel Okereafor. Please, can you step in to answer that question, ma'am? Kindly tell us what you do in your role as a developmental child psychologist and how you got into the role. Thank you.
Thank you, Ranti. As a developmental child psychologist in my practice, basically I meet with parents, get to understand their concerns about their child, and also arrange to meet with the child. When I meet with the child, we want to understand what the gaps or the difficulties and the support needs are for that child, and then work with the family to draw up a plan of support and intervention. So how did I get into my role? Basically, I would say the field found me. Initially, I wanted to, first off, I wanted to be a diplomat. That didn't work. You know how it is with the Nigerian educational system. You apply for a particular course, you do your JAM, and JAM just jumps you out, and then you find yourself in another field. So After that, I discovered that, okay, so I didn't get international relations when I applied. I was given psychology, and that was because they looked through my courses and it had a bit of science orientation. Particularly, I did biology. So they said, okay, go to psychology. And I did psychology. My first job was administrative, but my second job was as a psychologist. And when I tasted it first, I think I met a child on the autism spectrum, and she sort of shaped my perspective to life. And from that point and on, I decided that I wanted to do something that can significantly impact humanity. I wanted to do a job that would not just more like not just boost my pockets, but I wanted to do something that had impact that could touch lives. So basically, that's how I started and grew over time. Thank you.
Thank you very much, ma'am. I appreciate that. Mr. Francis, are you ready for us? Dr. Francis, I mean. No. No. Okay, the aim of this question is to actually pass it around to all the speakers. So we'll be going around. Every speaker will tell us how they got into their role as what they are doing now and what they do in that role. So next up is Dr. Victoria De Niro. Please, over to you, ma'am.
Hi, good morning, everyone. Thank you for having me. So I'm a podiatrist or a foot and ankle surgeon. And what foot and ankle surgeons do are we deal with any disease, any ailment of the foot and ankle. What is most popular is diabetic foot wounds. When people have diabetes, they have excess sugar in their blood. And a simplified version is that the excess sugar can attach to different structures in the body. It attaches to the nerves, and then people can't feel well, especially on their feet. And so if you don't feel well, you don't feel when you get a cut, you don't feel when there's a stone in your shoe. And so a lot of times these big wounds will develop and they take a while to heal, especially with diabetics. So diabetic foot wounds, diabetic ulcers. There are also bony issues. If someone breaks their bone in the foot, ankle bone, any of the foot bones from an accident, a car accident, from a fall, that will require surgery, or at the minimum a cast. Even simple things like foot pain, we make special inserts that will go into the shoe that are customized to a particular person's foot. There are dermatological things that podiatrists do. Basically every area of medicine, dermatology with the skin, vascular with blood, when it relates to cancers, when it relates to bone, but all just within the foot and the ankle. So there's surgery, there's wound care, there is preventative care, there is the daily bread and butter, what we'll call treating corns and calluses, things like bunions when the big toe is bent over, or hammer toes where instead of when the toe is straight, it is bent. Painful things in the toes, there can be fibromas, there can be lumps, basically hard lumps, things that form in the feet that are painful. Any issue of the foot and ankle that can be treated surgically or non-surgically, that is my line of work. And how I got into this line of work was in 10th grade in high school. In the US, I think that should be about 200 level in secondary school. I was a part of an academy, a medical science academy that introduced all manner of medical fields, from medical illustrator to nurses to radiological technician, every field. But the one that caught my eye was podiatry because it was different. And so I went to what we call shadow, a podiatrist in my area. I reached out to him and said, can I follow you for a day? Can I talk to you? Can I see what you do, what it's like? And he accepted. And I was so surprised with how welcoming he was, because I was just a little kid, but he really gave me full audience and told me all about the profession. He let me meet one of his patients. He let me make a molding for an orthotic, let me make a cast for a foot, and I fell in love with it. The funny thing is, what you'll see is a lot of podiatrists in the US, many of them came about it indirectly. Maybe they wanted to do another route of medicine, but they didn't get accepted into the school, or maybe they wanted to do dentistry or pharmacy, but it didn't work out. And so they now ended up with podiatry. But for me, it was my first love. It was something that I fell in love with once I saw it, and I just stuck with it.
Thank you very much, ma'am. Thank you for your answer. It was very, very enlightening for me personally. Um, do we have Mr. Taiwo James? Are you with us?
Yes.
Mr. James.
Yeah, can you hear me? Am I audible?
Yeah. Yes, you're audible. You're audible.
All right. Good afternoon.
Did you hear the question, or should I go right again? Good afternoon.
Yeah, you can. Yeah, I heard it.
Okay.
And thank you for having me here once again. I'm a nurse, and I'm here working in Lasud. And how I found myself in this profession, I think before I go to that, my job allocation in this health talk, or in this health, what's it called? Health aspect is to prevent, to promote, and to alleviate disease. And when we're saying with prevention, how can we prevent illness? Is being aware of the kind of illness that is that is going on within the, like, let's say, pandemic, like this pandemic that we just faced recently about this COVID-19 and all. If we have a like the people that were contacted with, if they were aware of how to prevent it, most of them would have not been a victim into it. So if we are here to give a proper education on how to prevent, to promote the illness, in case if there's anyone that has been contacted with any disease whatsoever, our job is to promote the health by giving them the proper medication, administering proper medication to them, and to keep checking on them regularly and all till their health got improved. And alleviating of diseases, we have a lot of some diseases that can be alleviated, that can be cured totally, like that will not be relapsed again. So in such aspect, by giving a proper medication, and how can we get this? All this is when the patient, or when the person that is involved is aware of what is actually, when the person have an insight of what is happening to him, and they come to the clinic, they go to the any health care, either public, what's called community health center, hospital, and all these aspects. So when they go there, they give them they place them on, they do some physical examination on them. After doing that, they diagnose them, and after the diagnosis, that's when they will now know what actually happened to them. But if the patient doesn't have an insight, because there are a lot of people walking around in the whole time, in the whole world, carrying one or two diseases around, in which they were not aware of. They don't even know. The only thing they know is when they fall sick, they go to chemists, or they go to over the counter, maybe the chemist over there to give them a drug over the counter, and the drug they will give them over the counter will just subside the pain. If they are feeling pain, there must be something within the body system before a pain can come up. maybe there's infection or there's one underlying cases going on. But if the person involved decided to go to chemist or go to what is it called? All those, there's some small shops out there that they sell, they are turned themselves to pharmacy, and we call them mini pharmacy, that they go there without going for proper investigation, proper checkup within the hospital. There's no way all these 3 points that are divine enough can be accomplished, which is the promotion, prevention, and alleviation of disease. And how I found myself in this profession was so funny. Like I've 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 sat for jam several times. I passed jam, I went for post jam, everything was just forfeited. So there was no one, there's one of my friends that now invited me that just told me about this course in India. Like, okay, can you do it nurse? And in my secondary school time, I'm a science student. So I now told him like, yes, I can. Why couldn't I? Like, if there's something that will just make me, that will just take this depression of a thing of seeking for admission over time to just go, like I can. So I now applied. I went for the study. I spent 4 years in India. After doing the course, I came back to Nigeria to be recognized in Nigeria, and now I found myself in the profession properly, in which I initially it's not something that I fell in love with. Let me say during the first year, second year, there's some tedious subjects there that was so tedious that I was thinking like it's not possible for me to skip through it. But when I got to my third year, I started finding it so funny, interesting, and since then I developed myself more and more every day on it, because I see myself in the next few years to come is not where I am today. I've got to be. So I keep on upgrading myself. Until now, I can say I love the job I'm doing. I'm proud of it. And I talk to people coming behind me. Like it's good because actually it's nothing. What people think about nursing is just for female, like the female profession. Like okay, it's the female agenda, they dominate it. But it's not that it's because of we gent, we male, we are not finding we don't find our interest in it. But let me say like 5 years or 10 years now, like ago, there are a lot of male nurses coming into the profession, and everyone that I've met as a male nurse, I think they can share the kind of things, even maybe more than the things that I'm feeling right now in the profession. So thank you very much.
Thank you so much, Mr. Taiwo James. Really appreciate you. Dr. Agbaraolorunpo, please, are you ready for us now?
Yes, I believe you can hear me now.
Yes, loud and clear.
Okay, then. Sorry for I have to shift to my Android since the laptop, I guess I've not tested it. That was what I was trying to do. So can you go over the question again, please? So I refresh my.
Okay. Kindly tell us what you do in your role in the psychology department, physiology department, of University of Lagos, and how you got into your present role.
Okay, thank you. At the Department of Physiology of the University of Lagos, I am saddled with the responsibility of educating students in the health science field, namely the medicine, the dentistry, the dental students, the pharmacy, the physiotherapy, the radiologists, the medical lab scientists, the biomedical lab students, a number of students, because physiology is the foundation of health science. Physiology is the foundation of medicine. And that's why in the Nobel Award, you will see the prize for medicine and physiology. So they go together. So any professional to practice in their field, at least they have to grasp this knowledge, physiology. And what is physiology? It is just the way the body works, organism generally, plants, animal, human. But in the earth field, we zero down on human. So the way all the levels in human works together, the cell, the tissue, the organs, and the systems. And students are so excited in their 200 level. The courses offer in most schools at 200 level. So students come with their background knowledge of biology, but physiology is beyond biology. So we teach them how the body works and how this can apply to their different field. That's the first role as an educationist. The second role is for those who are going to major in physiology. We train them to be potential researchers, to discover knowledge. Why this is this. For instance, we want to find out why salt is responsible for hypertension. We want to find out why some individuals are not fertile, why they are not giving birth to children. We want to find out A, B in the human. So our students are involved with research, and we teach them the principle of research using animal model, using human, and using some cells like stem cell in performing this role and responsibility. Then thirdly, our students equally are exposed to the clinical parts of the physiology. And what we do is we send them to hospitals, private, public, to learn the various physiological practice in making diagnosis. And the common areas they go into is learning how to make diagnosis of some heart-related problem, lung-related problems, brain-related problems. Normally, what they do is not really, is to assist the doctor. So there are machines on which we test, like ECG, for instance, the electrical activities of the heart. So from the school, they learn how the electrical activity is generated and the principle. Then we teach them how blood flows in the heart and if there is any problem with the valves. So, and we equally expose them to the machine, and they go to the field to see how the machine are being used. Equally, we the brain activities, for instance, for those with epilepsy, sometimes you have to perform their brain function test. So they equally go to the field to learn hands-on on how this machine are used and how the readings are interpreted. So these are the our principal role: education, research, and clinical training of our students. How did I become a physiologist? Well, also by providence. My first choice was medicine, and my first jam, I couldn't get medicine. I got biochemistry. That was in Futa as my second choice. But I had challenge with my mathematics, so I couldn't proceed for my biochemistry. So my second jam was when I was offered physiology. Second choice at the University of Lagos. I had my BSc in physiology. I fell in love with physiology, but I was not sure if I wanted physiology. I proceeded to study medicine and surgery. That was a direct entry with my physiology, because with physiology, you can proceed to study medicine, direct entry. I completed my direct entry. I completed my medical program, medicine and surgery. Thereafter, I proceeded for my master's in physiology, then proceeded for my PhD in physiology. I'm done with my physiology. And I think it's pretty interesting because otherwise, after my medicine and surgery, I would have gone into my fellowship, maybe a specialty in surgery, gynecology. And interestingly, let me tell you something about in the interesting parts of physiology. It's the only program in our medical school that students who enter for medicine and surgery can also graduate with a BSc degree in physiology. And we've had a number of our students who, once you do the physiology and you score very well distinction, the school can encourage you to just go to 400 level when your classmates are in their 400 level. You will go to 400 level physiology. And most often, a number of them graduate with first class in physiology and then proceed with their medicine and surgery. And they still pick interest in physiology, and some of them are currently undergoing their PhD in some international university. Thank you.
Thank you very much, Dr. Agbaraolorunpo. So I have a little announcement. Mrs. Mabel Okereafor, she's not going to be with us till the end of this session. So we are going to permit her to go first. So we'll not delay our other activities. Thank you for your understanding. So over to you, Mrs. Mabel. The next question I have for you is, why is what you do important? And is this the profession you advise young people to aspire to do?
Thank you very much, and thank you everyone for the opportunity to go first. Basically, why is what I do important? I always tell people that the future of any nation is the children of today, right? If our children have a good start, it means our future as a nation is secure. And as a developmental psychologist, usually our focus is around providing positive systems of support for children right from infancy, right? When the brain is just beginning to build foundations for lifelong learning. So for me, that is so important because it's more like you want to build a story building, and you want to ensure that it has a very solid foundation, whether you want to become a physiologist, you want to become a nurse. So we basically are there at the start of your life to ensure that we're working with your parents, we're working with families, we're working with school systems, we're working with governmental systems to ensure that as a society, we'll create an enabling environment for children so that they start up strong, irrespective of whatever career they want to pursue in life. We want to ensure that parents have the support they need to be able to create that environment for their child to grow and thrive. So we want to be able to see that children move from survival to thriving, and we work with families in terms of parenting education, in terms of providing information on early brain development and how to support best outcomes, how to protect children from adverse life effects, how to help them raise their children to be emotionally strong adults. You agree with me that as humans, that's the foundation of life. And even in situations where for maybe biological reasons, for environmental reasons, as you have in children from deprived environments, whereby they have compromised cognitive functioning, we're also able to provide support as a developmental psychologist by ensuring that that child gets sufficient stimulation to help them overcome whatever adverse effect they have. So we also are able to support the learning of children in terms of diagnosis, assessment, providing therapy. So for me, I think that is super, super important because you are at a place where you are helping society nurture the seeds of the future. You are at a place where you are empowering parents and families to be able to ensure that the leaders of tomorrow are supported to thrive. They are supported to become the adults they want to become. So for me, to that extent, it's a very important career choice. And that's why, like I said, even as glamorous as being an ambassador seemed, when I found something that I felt had more impact, right? I needed to shelve that. And I work in the early intervention space. And in the early intervention space, where we see children from birth to 5 years, there's a lot of change that we're able to bring about in terms of life outcomes for children. And for me, there's nothing more fulfilling than to be able to look at an individual, look at whatever needs they have, and to be able to provide support to move them to the next level of life. So for me, it's an area I would very much encourage people to go into. There's so much happening in society. There's so much happening in terms of parenting right now. So people need help. People need support. So as developmental child psychologists, you are able to step into that place to build programs that are supportive of people and help them to thrive. So yes, it's one area I would very much encourage young people to go into. Don't be scared, because in Nigeria, you hear, oh, if you're a psychologist, that means you're a mind reader. No, we don't read people's mind. It's not sorcery, it's not witchcraft, it's science. Right, there's a lot of evidence-based practice in terms of looking at the research that has gone on to say, okay, this is what works for the optimal development of the individual. When we do this, we're able to raise children that are solid, children that are strong emotionally, children that can thrive. So when we take those research findings and evidence-based practices, then we're able to support our society. So yes, it's one area that I definitely would encourage young persons to explore.
Thank you very much, Ma. Before we continue, if you have any question or contribution, if you don't want to speak out, you can just leave us a message here. I'm going to read it to everybody. Yeah. Thank you for that. If you have anything to say, any question, just shoot me a message. I'm going to read it to the house. Thank you very much. I'm still on Mrs. Mabel Okereafor. What skills, I mean, including soft skills, are necessary to develop for this profession?
As a psychologist, when you work with families, in terms of soft skills, you have to be empathetic, right? You have to be able to put yourself in the position of the families that you support, right? You have to be able to think from your perspective. There's this site that supports families of children of disabilities called A Day in Their Shoes. So for you to be a psychologist that supports family, you have to be able to put on those shoes from time to time to understand the emotions that come with whatever families are going through. You have to be a good communicator in terms of your listening, right? You have to be able to listen and to understand the implied meaning of what parents are trying to communicate with you. And if you work in an environment like our own environment, you have to really be culturally sensitive, right? So it's beyond, apart from the courses you go and study in university, you have to be culturally sensitive. What works in terms of a Yoruba cultural setting is not what works in the Igbo setting, right? What works in that setting will not work for the Hausa person. So you have to understand how these variables come together to impact the dynamics you see when families come to you to discuss their child, right? And you also have to be able to understand the predominant culture of your society at large, right? There are certain things that we are just coming into as Nigerians. For instance, we're just beginning to accept that, okay, children with learning differences, children with special needs can actually learn. So we are moving from the point where we just occupy them. We're actually beginning to get to a point where we know that we can equip them with skills when we identify them early. So we have to understand all of these things and begin to be able to move with the times. And in that respect, when I say understand the cultural dynamics, so you're coming from a place where families didn't used to believe that it's what investing in the life of a child with special needs, they will never amount to anything. So why worry? You have to understand that to be able to help that family. You have to know where they're coming from. And I tell people, as a psychologist, you have to know that children do not exist in a vacuum. They operate within families. So you have to also be able to go above whatever difficulties families or parents are having in opening up, because you would have a lot of denials. So sometimes as a professional, when families come to you and you see a lot of denial in terms of what they're communicating about their child, you have to be able to patiently guide them through that process of acceptance. Because if they don't get to accept the reality of what their child is going through, you cannot help that child. We've seen instances where parents are talking to you, all the signs are there, and either the mom or the dad will say, there's nothing wrong with my child. And if you, as a professional, you just get offended, that's okay, go with your child, you will not be able to help that child. So you have to understand all of these nuances as a professional if you really want to be able to support that child and be effective as you work as a professional. You understand the social cultural factors, you understand family dynamics, you have to be empathetic, you have to be a good communicator.
Once we've done 3 years, you can't wait.
More of a listener.
Sorry about that.
More of a listener than a speaker, because you really want to hear them out. Most of our parents really don't have people they can talk to in our society. So when they come to you, sometimes it's a lot of unbundling, right? So you also have to be able to take all of that in and be able to support them beyond the course you will read and the subject combinations that will get you into a course of study.
Thank you very much, ma'am. Please, if it's not your turn to speak, please can you mute your device so you will not interfere with the noise from your end. Thank you. Thank you very much, Mrs. Mabel Okereafor. That was very, very deep.
You're welcome. Thank you for having me.
Yes, ma'am. So the next person on my list is Dr. Victoria De Niro. Yeah. Your question for you is like, what is the benefit of the juniors here? What subject do you say is very important to do in senior secondary school?
There's actually a website, aacpm.org, American Association of Colleges of Podiatric Medicine, that has all the requirements of the classes that you have to take in order to be able to apply to podiatry school. So how it goes is podiatry school has its own school. The same way, at least here, dentistry has its own school, pharmacy has its own school, nursing has its own school, the rest of medicine has its own school. Podiatry also has its own school. So you have to take physics, you have to take chemistry, organic chemistry, biology, and a few other courses. And don't let that frighten you, because honestly, I struggled with those courses, especially organic chemistry too, and physics. Oh, I hate physics. Oh my gosh. It was so terrible. I repeated the course 2 times. I took it 3 times. And when I couldn't get a good grade in it at my university, I looked for a smaller school, a community college that I could take it over the summer, because they tend to be less challenging. And then if I'm taking it in the summer, it's the only course that I'm taking at that time. So I really struggled with that. I struggled, but eventually I made it. And you also have to take an exam called the MCAT. It's a standardized exam. The way we have JAM, there's a specific exam for the medicine field. Also, don't let that discourage you, because I also struggled with that. Somebody said when your name is Victor or Victoria, it means you'll be victorious, but it means you'll go through things. So maybe that's why. But I took the MCAT also 3 times. And I did some courses, like I paid for some preparatory courses that are supposed to help while you take the exam. So it was a very difficult process. I didn't get admitted the first time I applied. I had to wait. I did a master's degree. I worked for my mom for some time, and then I applied again, and eventually I got it. So there are specific requirements. Other than that, I wouldn't worry about taking excess classes because you think it will help per se, because they're not looking for any particular major. They're not looking for you to major in science or major in chemistry. You can major in anything, major in whatever you're interested in, arts, theater or whatever, you can major in whatever you're interested in. You can still apply to podiatry school as long as you have also taken those courses.
Yeah, thank you very much, ma'am. Okay. What are the challenges in your profession? To you, Dr. Adeniran, what are the challenges in your profession?
Funny thing, personally, I'll say the challenges I'm experiencing now are more challenges that have to do with maybe the working field in general, because myself and a lot of my peers, we find that we've been in school all of our lives. We've become professional students because we've done, primary school, grammar school, secondary school, or elementary, middle school, high school, and then we've done at least 4 years of university. Some people have done master's degrees or other programs, and then you now go to podiatry school, which is another 4 years. And then after the podiatry school, you start a training period called residency, which is 3 years. I'm in my training period right now. In Philadelphia, where I am, we're required to be fully licensed before we begin that training period. So I'm fully licensed, I'm fully a foot and ankle surgeon, and I practice in that capacity, but I'm still under training, under supervision of some other doctors. And so we find that we've been in school all of our lives, and now it's time to work. And, we're interacting with a lot of different people. When we're making a medical decision, you don't just make it on your own. You have to consult with maybe radiology. Okay, well, what did you think about the x-rays that you read? Do you think it's an infection? Do you think it's not? You have to talk a lot. We talk a lot with the nurses. I love nurses because they know everything about the patient. They're the ones that are there from morning to night watching the patient. We may come in for maybe 30 minutes, maybe an hour, but the nurse knows everything, this patient's schedule and how they've been improving. So we need to talk with them. We need to talk with maybe the speech pathologist, maybe the diet team. Oh, we had them on a low sodium diet before, but it looks like now their sodium levels are low. Okay, we need to increase their sodium. So different things like that. It takes a lot of interaction with different people, even just working with other coworkers. It's a lot. And we weren't doing that when we were in school. When we were in school, all we did was sit down, read our book, we study, we take the exam. Sit down, read our book, study, take the exam. But when a patient comes to the office, they don't say, oh, hello, doctor, my foot is hurting. Do I have A, gout? B, a toe cancer. C, my toe is broken. They don't tell us that. We have to deduce all these things. We have to pry the information out of them. So I think those are more the challenges that I've been facing just with dealing, with the workforce and dealing now finally working. I didn't realize how used to being a student I had gotten.
Thank you very much. Do you have anything for us, Niniola? Hello, Niniola. Oh, okay. Sorry. This question is for you, Dr. Francis. He said, is health science the same as medicine? Is health science the same as medicine?
Okay, can you hear me now?
Yes.
Okay, is science the same as medicine?
Medicine.
No,
yeah, medicine.
It's not the same as medicine. Health science is not the same as medicine. Health science Are you hearing an echo, please?
Yes, you have to mute one of your device.
Okay, then I'm leaving the other. Now, can you hear me?
Okay,
No
better.
echo. Yes, earth science is
No
not
echo.
the same as, and it's not the same as physiology. Medicine is a specialized field. In Nigerian, you have a training as you go through medicine and surgery and get a degree called MBBS. That is in Nigeria, and I think in other countries. And as a holder of MBBS, a degree in medicine and surgery, you are like the first point of call in the healthcare systems before other healthcare providers like nurses, medical lab scientists, radiologists, physiotherapy, before they come in. That is medicine. But health science is a broad field. For instance, there are schools of health science. And in school of health science, you can have all those health professions like nursing, radiology, medical lab scientists, physiotherapy, and public health. So that is the difference. They are not the same. Whereas the connecting area is physiology. Every student of health science will pass through the physiology course, but that does not necessarily make them physiology. Those who are going to become physiologists will now offer the course for 4 years, and they can proceed for their masters. That's what makes them physiologists.
Okay. She also have a question, another question for you. It said, what are the career pathways for health science?
The career pathway for health science, well, it's broad, just as I've said it. It's in earth science. Earth science is a very large field. And so the career pathway is, you want to become a doctor, yes, earth science. You want to become a nurse, that is a pathway. You want to become a physiotherapy, with them treating patients without using drug, you apply a lot of techniques, but apart from drug, which could be temperature, physical exercise, that is physiotherapy. Medical lab scientist, you want to assist the medical doctors in making diagnosis by looking at some of the samples. The sample could be urine, blood, tissue from breast cancer. Those are medical lab scientists. You want to look at imaging of the chest, of the abdomen. That is for the radiology. And there is pharmacology. The pharmacologists are those who will be doing research on drug and drug development, working in collaboration with the botanists to bring out the active agents in plants to develop drugs. That is their role. They are actively involved in partnership with the physiologists in drug development and biochemists. So, and there is also a new part now, that's biomedical engineer. For biomedical engineer is for those who are mathematically inclined, engineering inclined, and they want to offer solutions to they want to offer medically related solutions, such as developing machines with artificial intelligence, fixing some of the machine that will solve health-related problems. That is the field of biomedical engineering. So these are the career pathway for in the earth science, but we have for the physiology. But since the question is earth science, that is the career pathway.
Okay, thank you very much, sir. Okay, and for those that want to know the subjects that you need to study podiatry, you can check on our chat here. You see the link to the site. Thank you very much. We have a question for Dr. Adeniran. He said, how is podiatry related to orthopedics?
So orthopedics has to do with all the bones in general. If somebody breaks a bone in their shoulder, somebody breaks a bone in their spine, any bone at all throughout the whole body. Podiatry, and it's only bones. Podiatry is bones of the foot and ankle and everything else in the foot and ankle, whether it's the muscles, somebody pulls a muscle or they tear a muscle, somebody rips a ligament that connects one bone to another, somebody rips a tendon, somebody has a cancer or a fibroma, a very hard mass in the foot. Somebody has pain in their foot, general pain, whether it's gout, whether they have a muscle imbalance. Even with children, we see club foot. When you see a baby that's born and their foot is curved and pointing inwards, or children that have other foot issues, maybe they're only walking on their tiptoes, maybe they're born with extra toes or less toes than they need. Anything at all, not just bones, with the foot and ankle is podiatry. Funny enough, you'll find some podiatrists that said they initially wanted to go into orthopedics, and then it didn't work out, or along the way they found podiatry and they rerouted. And you'll see that in each hospital, the relationship with podiatry and orthopedics is different. Most orthopedics, I tell you, are not specialized enough in the foot, unless they are what is called orthopods, because they went to medical school, general medicine, learning about everything just generally. And then unless they did an additional fellowship additional fellowship or residency after medical school, aside from their orthopedics residency to specialize on all the bones, unless they did an additional one to specialize on the bones of the foot and ankle, they're not as keen, they're not as informed on all the specifics of the foot. So a lot of times they'll say, this foot, I don't want to deal with it. They'll send it to a podiatrist. There are those that do have that additional residency, that additional specification, but I'm telling you, that's like, you're looking at school in the teens, maybe 15 years of school and training and all of that. But podiatry, right after your undergraduate university, your 4 years or however long you took, you go into podiatry school. Where I am now doing my residency training, we also rotate with, as in we have different months that we spend with the orthopedics department. And in our hospital, the orthopedics department doesn't have any residents. So when we are on call, we also take call for orthopedics. So if somebody comes into the hospital and maybe they broke their knee or they broke their hip or something, we're also seeing those patients during this residency training time. But yes, orthopedics is only bones, and it's bones everywhere. Podiatry is foot and ankle, bones, soft tissue, muscle, blood, vessels, everything in the foot and ankle.
Yeah, thank you very much. That was very enlightening. I hope that answered your question. So we have a question for Mr. Taiwo James. Person said, what are the different post-secondary school educational routes for your profession? Hello, Mr. James Taiwo.
Hello, can you hear me?
Yeah, okay. Yes, we can
All right.
hear you. What
Please,
are the different post-secondary school educational routes for your profession? You're about to say something.
yeah, thank you for the question.
Okay.
Before you can become a nurse, before you can become a nurse, you ought to have gone through some courses in your secondary school time, in which you need to know that, okay, you are in a science line, and such courses, such subjects are like, you have to know your chemistry, be good in your mathematics, English, physics, biology. So after that, been to like uh, uh, because I can say me because I didn't study in Nigeria, so I could say less more about how Nigeria process goes on. I think I'm communicating. So, but based on where I study, once you finish your secondary school, you know what you know the course that you are going for. You sit for your exam, you go for your post jam, and there's some courses like that chemistry, biology, mathematics. There are some universities that they will look into before they can admit you. If you don't have those courses ready, they might not admit you. So you have to have those courses. I think there's no much thing to do before you become a nurse, except of those courses. Once you have those courses and you have your the university, because we have little university that do nursing, like nursing degree in Nigeria. Few. It's not all the university that do nurses. We have school of health. We have school of health. We have uh, uh, college, nursing colleges, but the schools that admitted that do degree of nursing are few. Like these universities are UI, University of Ibadan, um, Lagos, what's it called? Lasucom, Lagos State, Lasucom. I don't know the full meaning like that. But all I know, the schools that I know of it is Ibadan, Uni Ilorin, uh, Obafemi Awolowo University, and some private universities like Babcock. Yeah, they offer nursing degree, because I think it's better to go for nursing degree directly than going through all those, because I think nursing is kind of stressful in Nigeria here. So if you have chosen a course, or you have made yourself like, okay, I want to become a nurse, I would rather advise that you go for degrees directly. So before you can now go for all these things, you have to have those uh, primary subjects that I've mentioned, like all those mathematics, biology, chemistry, your English, and all like that. So once you are done with that, you've been admitted to the university. You go for your courses. You go for it directly. They teach you. They put you through. They will expose you to clinical settings, clinical activities, in which they have few months. Mostly you spend your time in classes, like first, second year, you spend your time in classes. But they have few months, maybe 2 months, in which they will use to expose the student to the clinical setting, in which they will be making them to be more conversant with patients, hospital environment, the healthcare, the other healthcare members within the hospital. So with this, I think to be a nurse is just being have a foresight of what you want to be, and you go for it. Thank you very much.
Thank you very much, sir. Also, we have another question for you still. It said, what are the challenges that you encounter in your profession?
Like I said, we have a lot of challenges that we are facing. It, it's nothing. Yeah, yeah, yeah. So
Yeah.
we have a lot of challenges we are facing in nursing presently, in which it takes, let me say, grace to keep furthering, to keep moving. And the first challenge is a long shifting. We spend, the nurses, we spend most time with our patients. We spend, let me say, almost, like say, 80 to 90% of our time with the patient. So, and now there's shortage of nurses presently, let me say presently in Nigeria, because mostly all the nurses, they are seeking for greener pastures now. So presently in Lasut, where I'm working, we are short of staff And due to the short of staff, our working time has been elongated. Perhaps before we work, we have 3 shifts a day, morning, afternoon, night. Now, due to the shortage of staff, the roster changes, in which we do morning and by. The by is night, and sometimes 24 hours. And for a nurse to be and for a nurse to be on the ward for 24 hours, you know what that takes for 24 hours. And we are facing these challenges due to the shortage of staff that we are facing. And the other challenges is changing of schedule in the sense that uh uh maybe the roster has been scheduled at the beginning of the week, due to you have already know the day that you're coming to work. You know the day that you'll be off, because we have off day. Someone that work for 24 hours, it's like it's the person have an advantage of having 2 to 3 days off. So due to that, maybe the person that is supposed to take over from you, we just call him and be telling you stories like, okay, maybe it's genuine or not genuine. They just tell you that they will not be able to come, or they will not make it, or something. And you will not have to leave your patient. You cannot leave your patient unless there's someone that will take over from you. So due to that, you have done 24 hours, your time will be elongated. You will spend more hour with the patient because it's not scheduled. It's just an impromptu call that just called me. So due to that, we just make it. Perhaps you'll be angry. You'll be angry that moment, but you with what entails is more than what the anger that you'll be feeling. You will have to wait because life is involved. So, and the other challenges we face are emotional involvement, because there's some of us that we have empathy, we have sympathy. So let everyone have that, but in nursing, if you don't have sympathy and empathy, you might not able to handle your patient very well, because you have to feel what the patient is feeling. You have to see what the patient is not even seeing. You have to enlighten the patient. You have to tell the patient so the patient can have the insight of what they are feeling, what they are passing through presently. So with that emotional stuff, maybe someone that is crying, a patient is crying like profusely, like crying, continuous crying, and you keep on asking what's happening, and suddenly the patient suddenly like just open up to you like, okay, due to this, due to that, you will have the feelings like, if I'm the one feeling this thing, how will I go through it? How will I feel? What are the things? So you just have the empathy towards what the patient is telling you, and due to that, you might just burst out in crying with the patient. So those emotional involvement are there, and demand. Physical demand is there also, because let me say, if someone that stands, because it's a standing ovation job, that stands for 12 hours, that stands for 24 hours. It's not like maybe we don't sit, but maybe when you are sitting, a patient will just come like, hey, my brother or my sister needs this, needs that. You're about to sit, you stand up again, you go and attend to the person. After you finish that one, you come back, you want to sit, another person's patient relative will call you again and ask for another favor in which you have to do. Then we expose ourselves to illness due to lack of equipment. There's not enough equipment like provided by the government. So most times we improvise, and while improvising, there's a procedure. Maybe there's a procedure we are supposed to use an hand glove that we are supposed to wear a gun to carry out the procedure. Due to the lack of the equipment, we go because we want to ensure that the patient get what they want. We are working towards the improvement of the patient. We go there and we carry out the procedure. And if it is a procedure that is meant to face us back, we face it. That's why during the COVID time, a lot of nurses died, a lot of doctors died. It's not due to maybe there is not a lot of maybe they don't know what to do to prevent that, but due to like there is a life involved. So they will just have to do whatever they want to do to secure the life of the patient. So if I say I should continue, I have a lot of challenges that we are facing. Is it the lack of nurses, in which I've mentioned, changing of technology, poor treatment from patients, mandatory overtime, safety of job, workplace violence, in which patient relative, they fight you, they fight the nurses, they fight the doctor. Like there was a case that happened last week because I work at the emergency, I'm an emergency nurse. The patient, they rush the patient down to the emergency due to accident, road traffic accident. So the ward has already been filled up. We cannot admit the patient. We just have to take the trolley out of the hospital to do the necessary thing to save the patient. So at least to stabilize him. Even though like we're going to refer the patient to another place, at least to stabilize the patient at that moment. In the process, I think the condition has gotten to a very critical one. We tried our best, we lost the patient. So in that process, the patient relative do not understand that we have performed some intervention to save the patient's life. But due to overbleeding, due to loss of fluid and electrolyte imbalance, the patient passed. They could understand. They were seeing it when we were doing the activities to restore the patient. They were seeing it, but immediately the patient passed, everything changed. Everything changed drastically. They started saying a lot of words. Due to that process, they started like breaking things around and all. Thank God for the security that were around within our judiciary that time. They were the one that saved us. So by that, we lack of workplace violence. That's when involved, and improve of self-care and all. So I think with this, I've made some few points to justify that question. Thank you very much.
Thank you. Thank you very much, Mr. James. Somebody is not clear about the difference between going to nursing school and University of Nursing degree. Like, what is the difference between going to nursing school or going to university for a nursing degree?
Yeah, when I said it's better to pursue degree than going for nursing school. Well, nursing school in the sense that we have college of college of nursing. College of nursing will not give you directly what you want, like a degree, BNSC in nursing. You will spend, if you go to College of Nursing, you will spend 3 years for us, either being a midwifery or a community nurse. Yes. They will not give you, it's not that you are pursuing your degree, in which if the person finish the 3 years, you are still going to further another 5 years to pursue the degree that you want. And what are we looking for? Every profession, if you are going for a study, you start your first degree, start from degree, master's, PhD. I think with my own perspective, if you have not attained your degree, you have not attained even let me say PhD, sorry, not PhD, what do they call it in Nigeria? After ND, OND. There's some organization that does not recognize OND as a degree. After finishing OND, they will still tell you to go furthermore to attain or to get your degree. So why not focusing on getting your degree directly, in which you have to spend maybe the extra 5 years you're meant to spend. You just spend it once and for all and know where you're going to. But once you go into nursing, college of nursing, you spend 3 years. That 3 years is not included with that 5 years the person will still spend to get the degree. So it's advisable to go for the degree directly. Like that was why I said there are some little universities that offer degree in Nigeria. UI, University of Ibadan, University of Ilorin, Obafemi Awolowo, and Bapo. Then LASUCOM. They offer that. There are still few, but those are the ones that I can remember right now. So if there's anyone that wants to, based on their own discretion, because when we're talking about this, it involves money, it involves capital. So I think most time why people go for nursing, college of nursing is maybe due to lack of capital or there's not sufficient money to food, because it's only if you want to go for that, you have to spend money. You spend millions, you spend a lot of money to get that. And to fasten your education, that's another advantage, is to fasten your education and to get what you need to get to move on in life. Thank you very much.
Thank you very much, Mr. Taiwo James. If you have any question, please don't hesitate to raise your hand or shoot us a question. Christiana, are you with us? Hello, Christiana. So yes. This question is for, okay, are you with us? Do you understand everything that's been said?
Yes. But I have a question for Mr. James.
Okay, go on.
No, I'll just like, okay, for a person who is not in the science line and wants to go for nursing, what do you advise the person to do?
That will be that. Sorry for laughing. That will be a serious one, because it's what we're talking about now is the earth sciences, and before you can see yourself in any earth sciences, you have to, from your background, from secondary school background, let me say from SS1, SS2, SS3, you would have know the where you want your what the right English to use is that. You should have know where exactly you're going to. Either you want to do commerce, you want to do an art, or you want to come to science side. So it will be so difficult for someone that is not a science student from background to become a nurse, in which is possible as well if the person can take the chances of maybe the writing WAEC or NECO or all those secondary school exams, and you write a science based on you go for your WAEC based on science course, science subject. That means you want to make a sacrifice for yourself. You want to become a nurse. You make a sacrifice for yourself. You take your time, you take your energy, but it's not that easy for you to just deviate to unlearn what you have learned and start learning a new thing. So it will take more, it will tell more on you. But if the person can take the sacrifice, if the person can take the challenges that comes with it, like starting from O-level results and reapply, even though you have gotten your degree in other departments, but you want to be a nurse, you have to start from WAEC. You cannot bring in a commercial course to nursing or to medicine or to any else. No. So you have to start from basics. The basics start from like the WAEC, and it will apply to wherever you want to be admitted to. So you have to start from there. I think I've answered your question, right?
Thank you very much, sir. Yes, sir.
All right. You're welcome.
Thank you very much. So this question is for Dr. Agbaraolorunpo. It said, what co-curricular activities would you recommend for students either at home or in school? What co-curricular activities would you recommend for students either at home or in school? We are not hearing you, sir.
Oh.
We can't hear you. We can
Hello.
hear you now.
Yes, you said curricular activity. Is it
yes.
Relations to earth science or generally academics, as it were?
Generally, as it were.
Okay, generally, anyway, for your career, you need to be studious. You need to be very inquisitive. You need to create that test and hunger for knowledge. You need to develop the thinking faculty. You need to be very analytical. You see, it's been said that Africans, we do not really read. And they've equally gone further to claim that we do not really think. They believe that we are the cramming generations, that we are only programmed to remember things the way it is given to us. And that is the challenge, for instance, I have with some of my students. They prefer questions that will test their ability to remember. They don't really like questions which will engage them in critical thinking. So when it comes to critical thinking, for instance, I could ask, for instance, taking their reproduction, ask about the science behind their menstruation. You will see a lot of them go blank, even though they are ex-professionals, as it were. So, and this is perhaps because they have not developed the thinking aspect. And for you to think, it is not the regular study you create. It is during it's like thinking can become an hobby. So you think, how did stage 1 result in stage 2 lead to stage 3? For instance, there is an insecurity problem in the country. You can just sit down and start connecting. It is because of this leading to this and leading to that. So it's very critical for you to do that. Then the next is during your extracurricular time, develop and build on your communication skill. Your communication skill is very vital for you to survive in school. Some of my students, what we find out is that they cannot really express themselves. Yeah, some of them verbally could express, but when it gets to paper, they cannot, and you will see that they lack this ability to express themselves. And for you to really be able to develop this communication skill, the thinking skill, you have to be a reader and you have to be deliberate in it. You have to give yourself a goal that, okay, in a month, I want to read a book. And it doesn't have to be a novel, as it were. So then aside from reading, you equally need to know what is happening around you, because you will see sometimes students become educated illiterate because yes, they have some knowledge, but they don't know how to connect those knowledge to what is happening in their environment. For instance, I've engaged some of my nursing students and MLS students with regards to the global events, pandemic, COVID. And you see that A lot of them do not even know that there is a new variant, what the new variant is all about, the knowledge about the vaccine given to COVID. So you equally have to create time, at least to be conversant about your environment, create a time to listen to news. And equally, maybe lastly, don't just think you know, don't just assume you know. You must have a working dictionary for you to learn new words and grow your communication skill. But because when you are able to communicate how you feel, nobody can repress you. You'll be able to expressly express yourself. Thank you.
Thank you very much, sir. Dr. Adeniran, please, we have a question for you. It said, how do you think your profession can develop in the nearest future?
That's a good question. Develop as well. I'll attack it from two sides. The profession itself is the way it will definitely develop is with more diabetic foot care, because diabetes is increasing. I had some statistics here, especially in the USA and in China. Diabetes is increasing. In Africa, there's not as much diabetes, thank God. There's only 3.1% of Africans living with diabetes. But I'll tell you, the country with the highest number of people affected by diabetes is Nigeria. And so because of that, it's increasing. And a lot of people will have diabetes and they don't even know that they have it. And sometimes they don't know until it's too late. Maybe they never got screened. They never knew anything about their blood sugar, or that they needed to take medicine or watch what they eat or exercise. So that's one way that it will definitely grow, because diabetes is always growing. Within the profession itself, I think any growth that we have internally will be due to technology. For example, with foot orthotics that we make, that maybe somebody has a very high arch, or conversely, they have a very low arch, they have flat feet. And so they find that their feet are always hurting right in the center. Or with a high arch, they find that the top of their foot is always hurting, or their ankle is always hurting. So what we do is we make a mold that is specific to that foot that can be put in the shoe. Once upon a time, we would always make that mold with plaster, with water and a plaster, almost like paper mache, that you put it in water and it gets milky, and after a while it gets hard. That's how we made it. Technology developed, and then there was a foam box, basically a box in the shape of a foot, generally a rectangular box made of foam, that the podiatrist will put your foot in it in a certain position, and it will make an imprint of the foot. Nowadays, what we're seeing and what's coming on the rise is a digital scan of the foot, where a person will have a device with a particular app, and they take pictures from different angles of the foot to scan the foot, scan the coordinates, if you will, of the foot, in order to make the same device. Right now, those digital scans are not as accurate as the aforementioned methods, but I think in the future, we'll have things like that. We'll have more accurate technological advancements.
Thank you very much. Thank you very much, Dr. Adeniran. This question is for Dr. Francis. Said, what are the benefits of studying health science?
Oh, there are a lot of benefits to studying health science. You know that for you to, especially that now the youth are being exported out of the country willingly, not through slavery. They want a better life for themselves. Health science is that route for them not to go through the Sahara Desert, and for them to be very, for them to be very attractive in the international market, as it were. Because with health science, it is on high demand in a lot of Western world, UK, US, Canada, Australia, Netherlands. And it is one of the high-paying job aside from courses related to data science. So it is very attractive. Yes, you heard the doctor nurse talk about a lot of people resigning from their workplace. It's not just limited to workplace. Nurses, doctors are resigning to go abroad. And it's because they are being demanded. They want them. And the benefit is that, yes, the government, the training cost is very low here in Nigeria. So, for instance, half of my classmates are abroad. That is where they practice. So you do the program here, you are not on loan, it is subsidized. ASRI is on strike presently so that we can maintain that subsidy. But for those who are financially buoyant, they still go to a school like Babcock, which I once taught, and there is Bowell. You do your program, and before you say Jack Robinson, you just do some qualifying exam, IELTS, test of English or TOEFL, and your friend asks where you are, your friends that study other courses, they say, oh, you are out of the country. You pass their qualifying exam because Nigerians are really intelligent. And one of the benefits of studying health science is that it stimulates your thinking faculty, your intellect. It is not for every dictums and Ari, and that's why you see studying any parts in the health science, some may not even practice in that field. They still end up as financial experts. They go into other field and excel because if you can try, you can succeed in the health science field, then you will most likely succeed in the other field. Then it's not just hospitals they practice, because you may be wondering, like even there are schools with clinical biochemistry, physiology, and all those. We generally call some biomedical science. We don't even call them physiology, we call them biomedical science. They are in high demand for scholarship abroad, so you can proceed. You are given scholarship to study at your PhD level, 3-5 years. And once you are done, studying abroad is better at the postgraduate level than study here because the environment is very friendly. And mind you, once you become a PhD holder there and you get a university appointment, you are an assistant professor. Here, you get your PhD, you are a lecturer 2, from lecturer 2 to lecturer 1, from lecturer 1 to senior lecturer, before you now come to something like his assistant professor. But abroad, finish your PhD, you become assistant professor. Then equally, there is, can I remember now, that we say science, math, engineering. There is a code acronym we give it. It is in high demand in Nigeria. Study any course related to math, science, technology, engineering. You are a hot cake. And one of these areas is medicine. And it's not just working in the clinic, just as I told you, and that is the role of physiology and some other biochemical. Those who are developing vaccine, those who want to find lasting solution to cancer, those who want to find lasting solution to sickle cell disease, those who want to find lasting solutions to Alzheimer, Parkinson, find solutions to reproduction problem, infertility, they are the scientists. And so you get a lot of support in a lot of Western countries, not Nigeria, where there is no light, I must confess. Then after you finish your PhD, you still have further opportunity to do fellowship. And some of this fellowship, you can bring in your wife, your kids, your partner to undergo the program for like 3-5 years, and which most likely after your fellowship in a particular institution, you can get into another institution Before you say Jack Robinson, you are already integrated into their systems and you are becoming a citizen. So earth science is pathway to global, to becoming globally competitive. People always say, why do you always focus on the global? You don't look at the local. I believe the goal of every parent is for you to attain your peak. So why should you be a local champion when you can be a global champion? That is my answer to them most times.
Thank you very much, sir. Let's have a question that only you haven't answered today. What are your challenges you face in your profession, sir? What are the challenges you face in your profession?
As Dr. Nurse equally mentioned, they are numerous. They are the politically, environmentally induced problem. For instance, I couldn't be in my office today, even though we are on strike, we still go to work. But the question is no light. Some of our research biological specimen like blood and that we collect, they get spoiled because there is no light, no internet. So we cannot even make research in the absence of internet. Then equally, a lot of the management, apart from the politicians, yes, we know there is a paucity of fund, but a lot of them are not, and they are our parents. Most time I equally encourage our undergraduates to speak to the parents. You see, there is a misplaced priority. Once you become the head, you want your official car, and that your official car can get a very good machine that could be very key to training, to research. But everybody, especially the older generations, are not ready to make sacrifice. So in terms of technology, we're backward. In terms of energy, we are not there. And in terms of a friendly study environment, we're not there. And our research is often interrupted by labor workers agitation. So Nigeria, yes, if you don't have the money, you don't have an option. It's like passing through the wilderness. But pass through the wilderness in your BSc, and if your parents can make saving at your master's, but I'm sure once you do your master's with your parents' money abroad, be diligent, you will definitely get a scholarship to pursue your PhD. For instance, one of my students that I tutor, when he was in secondary school, the parents were good enough to make sacrifice for him in Covenant University. He graduated with first class. Then with that first class, he was able to get scholarship abroad. He did electrical engineering, but the guy is now in X management. He's earning $1 million, that is in dollars. And sometimes he has the capacity to invite his parents over there. He has moved his sister. His sister was initially where I was teaching. That was in Ondo, medical science. But the sister now is doing a medical program abroad. So the challenging in Nigeria in the educational sector is limiting. Yes, I teach in a private school, university. They are through with their first semester. We are going to start the second semester now. But the public school is nowhere to be found. So things are collapsing every now and then.
Thank you very much, sir. In the absence of no other question, I would like to ask one final question, and everybody will have an input in it. So this final question is starting from Mr. James Taiwo. The final question I have here is, what word of advice do you have to give, or what word of advice would you give to young people today? So Mr. James, what word of advice would you give out?
Thank you. The short word I will give the the young people coming up, I'm still young also, it's self-motivation. Because a lot of people nowadays, like, we all know that even the motivational speakers, they are not even motivated. So if you are not being motivated within yourself, if you don't have the insight in life, the person will just remain, you will just be rendered useless. But once you have a capacity, you have the power, you have the strength within you, the inner strength within you to pursue whatsoever, either in earth sciences or in anything that you have in mind to do. Once you have it in mind, you have the strength within you, the capacity to motivate yourself. And with few things that you've seen around you that motivate you, I'm sure that person will be the pick of his game or her game. But if there is lack of motivation within self, like the self-motivation, I don't think anybody can able to achieve anything in this life. So self-motivation, I would just make the point on self-motivation to be able to get it. Thank you.
Thank you very much, sir. You said self-motivation. Dr. Adeniran, what would you like to say, please?
It's similar to what Mr. James Taiwo said. I would say, don't give up. It takes a lot of fortitude to go through the medical route because there's so much schooling, there's so much training, there's so much cramming, there's a lot of it. But I will tell you, we have an advantage because a lot of Nigerians don't have a problem with that fortitude. And you'll notice at least here in the US, there's kind of a joke that goes around about like, oh, can you pronounce your doctor's name? Because there's so many international doctors. Even medical students, they're coming from India, they're coming from Zimbabwe, they're coming from China, they're coming from Nigeria in droves. They're coming from all these different countries. And so you'll notice that people that are gastroenterologists, foot and ankle surgeon, rhinoplastic surgeon, plastic surgeons, they have these, quote unquote, foreign names. And I really feel that it's because people coming from outside of at least this country, America, many of them have this kind of drive, this fortitude, and they're willing to go to the limit to do what it takes to get there. I talked about my struggles with the courses, just getting into podiatry school, not getting accepted my first time. Even while I was in podiatry school, I struggled so much. The MCAT exam before getting into the school, also I struggled. Even after paying a good amount of money to be trained to do well on this exam, at that time, the range of scoring was between, I think, like a 14 and maybe 30 something. And I got a 17, like almost the lowest score after paying to do well. They had a higher score guarantee, so I was able to take the course again. I got a 17 again. I was like, no, this cannot be natural. It was hard, and then after that, that's when they changed the scoring and they changed the exam from a 4-hour exam to an 8-hour exam. I wanted to cry. It took me 2 weeks just to get over that alone. That the exam is 8 hours. But I worked hard, I kept going. You have to just not give up. And then I ended up doing well and getting into school. Even in school itself, I struggled a lot. I wasn't at the top of my class. I wasn't at the middle of my class. I was literally at the bottom of my class, maybe not the very last person, but it was hard. It was just very, very difficult. And I remember at one point I was the only Black person in my class, in my group of about 80 to 100 students. Not Black female, not Black male, only Black person. And there's so many things that can pose as disadvantages to somebody who is not, the average white male person, because historically that's what podiatrists have been. But if you don't give up and you put your efforts, channel them correctly, channel your efforts in the right way, seek help, then you can make it. Along the way, I've been able to find some mentors. There's a Dr. Babajide Ogunlana, there's a Dr. Muronda. These people I talk to, and they help me, they encourage me. And so if you don't give up and you find people that will encourage you, that will lead you along the way, there's no limit to what you can do.
Thank you very much. You said don't give up. Dr. Francis, over to you, sir. We can't hear you, sir.
Yes, can you hear me now? Can you hear
sir.
me? Yes, to my
Yes, we
mind,
can.
there are variables that really determine success. But students must know that success is not like a bed of roses. You must make efforts. You must make effort for you to get results. So, and making efforts, what I learned very early in life is that perfect preparation prevents poor performance. Perfect preparation prevents poor performance. You must prepare for your future like an athlete, and you must be focused. You must not be distracted. We have a lot of sources of distraction in today's modern world, and the Android phone is one of the distracting tools. You must convert your Android device to something that will help you to grow, not something that will destroy your life, not something that will mar you, because a lot are distracted. How many hours do you spend on Android? And how many hours do you spend preparing and working hard towards the future you are looking at? Then the other thing I learned when I was growing up is, and I'm still growing up, that the greatest enemy of your best is distraction. So you must not be distracted. You must not be distracted by friends that you keep, because friends that you keep can derail you or distract you from your destination. I read somewhere 3 things that will determine your life. 1, the friend you keep. 2, the meeting you attend. For instance, you have attended this particular meeting put together by this great team. Yes, you must attend such more meetings that will impact your life positively, and associate with friends that will positively impact your life. Then the third thing the person said is the book you read. The book you read. Never read destructive books. There are social media posting and what have you. Some of them are very destructive. When they are sent to your phone, you help yourself by deleting them, because they will not do good to your destiny. They are addictive. They are addictive. You get glued to them. One of the research my team just embarked on is the addiction to game. And you will see the prevalence of addiction to game among even university students is high. And it seems to be affecting the performance, the academic performance of some of these students. So don't become a game addict to your phone. It's going to definitely affect your destiny. Don't try to go through the crooked way. Some parents are the one encouraging their kids to go through the crooked way. You will see some kids do not even pass the jam. I had interaction, and you will see. The question is, God's word says, the scripture, if the foundation is destroyed, what can the righteous do? So you must equally be very careful that your parents do not, because of the works they have, destroy your foundation by seeking for answer, seeking for those who are going to write the exam for you. They are becoming better. See, one of the science of physiology is that the law of use and disuse. If you don't use your brain, if you don't challenge your brain, then the brain is going to get weaker. the size is going to grow weaker. And what it can intellectually solve will diminish. And that is the damage parents can do when they support you, indulge you in examination malpractice. And when you are used to examination malpractice, yes, you can advance, but there will always be a point that you go very high and you crash. And that is why you must say no to examination malpractice, no to game addiction, and no to drug addiction, and no to sexual perversions that can really stagnate your life. We see the effect of this among our students, and that is why I am saying this. I've interacted with the best students in WAEC, in JAM. For instance, in my class here, we had the best WAEC students, the best JAM students. I've lived with them. I've interviewed a number of them. And you see the price of success is constant. Diligence, passion, hard work, and be focused. So those are my submission. Thank you.
Thank you very much. We appreciate you, sir. So we have come to the end of this session. We want to thank every of our speakers for their time and their patience with us. We really appreciate you. God bless you.
Okay, thank you. Thank you everyone for making it. Thank you to our speakers. Thank you, Rotsi, for moderating this session really well. Thank you, Dr. Adeniro. Thank you, Dr. Francis. Thank you, Nurse James, and thank you, Mrs. Okereafor. Thank you for your wealth of knowledge and experience that you have shared with us today. Personally, my eyes were welling up with tears, to be honest, when I was listening to Dr. Francis. You know, it's I usually feel a personal loss, as in it feels like a personal loss when I hear of doctors leaving our country. One of my I always call my little cousin. She, after studying medicine, she came to Nigeria. I think she really wanted to contribute her quota here, but she couldn't cope anymore, and she left shortly after COVID. You know, and I felt like it was like a personal loss to me. And as you were speaking as well, you know, it's really depressing when you hear these things. You know, I mean, just a little thing as lights, not having lights, not having, not have, as in, it's really depressing for me, you know, that our best hands need to leave the country, you know, but I still believe in Nigeria, and that's why I do what I'm doing. You know, I believe that Nigeria will get better. I believe that our people that are going out of the country, there will be a time like the Israelites that they will come back to the shores of Nigeria, and they will come to make Nigeria better. So I'm not going to give up hope. I'm going to keep on doing what I'm doing. And I thank you all for your time. I thank you. I thank the people, the medical professionals who, against all odds, they're actually doing their best here with the resources they have. And I thank the ones who are going, because I know that they will come back. I look forward to when I'll see Dr. Adeniran here in Nigeria, working and also teaching here in Nigeria as well. So once again, thank you to everyone who has made it here. I thank our sponsors, Help Alliance. They sponsored this program, and Help Alliance is the CSR arm of Lufthansa Airlines. I thank our partners, Mapubi Foundation from Germany. And once again, thank you to our speakers and our participants. And I'd like to say thank you and goodbye for now. I hope to keep with everyone here. Thank you.
Goodbye.
Okay. Goodbye, everyone.
Goodbye. Thank you for inviting us.
Thank you.
Thank you very much.
Yeah.
I appreciate it.
Yes, sir.
And
Bye.
sorry, I could not show my face. I'm at work, walking around, so that's why I couldn't show my face.
We understand. Thank you so much, sir. Thank you. One of the reasons why I called you, and you said that there are not too many male nurses, and that's why I insisted on having a male nurse to speak here, so that young people see that there are male nurses and there are female doctors. So thank you very much. Thank you. Thanks, everyone. Okay. Bye.
Bye-bye. Bye. Yes, I can concentrate now. Ooh.